Assalamualaikum and hi to everyone. Today we will be talk about medical and healthcare technology, mostly focused in X-ray imaging. How electricity and magnetism apply in real life. And before we get into our topic, here are our group members, and we are from class RAS1203B. You can know that from every piece of modern technology relies on fundamental principle of electricity and magnetism, ENF. This is often found in field where precision and non-invasive methods are critical, which will focus on X-ray imaging, because it is clearest example of ENM. We will explore how controlling electricity current and high voltage differential create powerful electric field to accelerate electron, which then produce high energy electromagnetic radiation when accelerated. Now we're gonna look at what are the significance of X-ray. Firstly, it is a non-invasive diagnostic. It allows doctor to see inside the human body without the need for surgery. This non-invasive nature is critical for patient safety and comfort. And secondly, it is a rapid diagnosis, which are X-ray images are generated quickly, making them a better tool in emergency medicine for diagnosing conditions such as bone fracture and discoloration, infection and disease, foreign objects swallowed or inserted. And lastly, it is cost effectiveness and accessibility, which are compared to other advanced imaging modalities like MRI or CT scan. Plain X-ray are more often faster and less expensive compared to others.
My name is Fatin and I will explain about the electricity and magnetism concepts used in X-ray imaging. First, high voltage and electric fields. X-ray machines use very high voltage to create a strong electric field inside the X-ray tube. The field accelerates electrons from the cathode to the anode. Higher voltage gives electrons more energy and produce X-ray with greater penetrating power. Next, thermionic emission and electric current. The cathode contains a heated tungsten filament. When heated, electrons will escape from the metal surface through thermionic emission. The flow of these electrons forms an electric current, and a higher current produces more X-ray. Moving on to electron acceleration and X-ray production. Electrons travel through a vacuum and gain kinetic energy from the electric field. When they strike the anode, they suddenly slow down and X-rays are produced. Now, electromagnetic radiation. X-rays are a form of electromagnetic radiation with very high energy and frequency. They are produced mainly as Brans-Strahler radiation and characteristic radiation when electrons interact with the anode material. After that, magnetic fields and beam control. Magnetic fields are used to focus and control the electron beam inside the X-ray tube. This improves image resolution and help reduce unnecessary radiation exposure. Finally, interaction with metal and image formation. X-rays interact differently with body tissues. Dense tissues such as bones absorb more X-rays than soft tissues, creating image contrast. The detected X-rays are then converted into a visible image.
This slide shows the medical application of X-ray in real life. First, we have diagnostic radiography, which is the most common use of X-ray. Plain X-ray are mainly used to check bones, such as detecting fracture, dislocation, and bone diseases like arthritis. Chest X-ray are also very important because they help doctors identify lung problems like pneumonia, tuberculosis, lung cancer, fluid in the lungs, and even an enlarged heart. Next, we had advanced imaging technique. One example is the CT scan, which use multiple X-ray images taken from different angles to create detailed cross-sectional or 3D image. CT scans are useful for detecting tumors, internal bleeding, stroke, and complex fracture. Another example is mammography, which is a low-dose X-ray specifically used to examine breast tissue and detect early signs of breast cancer. This slide talks about the industrial and security application of this technology, focusing on real-world uses. First, in industrial application, it is used for non-destructive testing, also known as NDT. This means engineers can check the quality and safety of materials without damaging them. This is very important in industry like aerospace, construction and manufacturing, where safety is critical. NDT is also used for flaw detection. It helps identify hidden problems such as cracks, corrosion, voids or foreign objects inside materials. For example, it can inspect metal webs, oil and gas pipelines, and aircraft parts to make sure they are safe and reliable. The second major application is security screening in places like airport and seaports. This technology is used to scan luggage, cargo and mail. It helps detect prohibited items, weapons or contraband without opening the bags. In more advanced security systems, CT scans are used to provide higher resolution image which improve accuracy and safety during inspection.
Now we will continue with the potential benefits of X-ray imaging, which is speed and efficiency, non-invention in sight, versatility, and cost-effectiveness. For your information, X-ray remains the first line of defense in diagnostic imaging for several compelling reasons. The first benefit is speed and efficiency. X-ray can take milliseconds to capture and minutes to process, especially with modern digital radiography. This is critical in emergency rooms for assessing trauma such as car accident injuries. Also, X-ray machines are available in almost every urgent care center, dental office, and hospital globally, unlike MRI or PET scanners, which are expensive and scarce. Next, the non-invasive insight of X-ray. X-ray shows painless visualization. It allows doctor to see inside the body without making a single incision. X-ray are the gold standard for viewing bones and teeth. This is because calcium absorbs X-ray effectively. Bones appears bright white, making fractures, infections, or acoustics easy to spot. Next is the versatility. X-rays are incredibly effective at locating swallowed coins, metal fragments, or kidney stones. It is the primary tool for diagnosing pneumonia, lung cancer, and heart failure. Last but not least is the cost effectiveness of X-ray. X-ray cost is lower compared to advanced modalities like CT, the computed tomography, or MRI, the magnetic resonance imaging. X-rays are significantly cheaper. They serve as an excellent screening tool to decide if more expensive imaging is actually necessary. Now, we will discuss about the potential challenge of X-ray imaging. While indispensable, X-ray technology has inherent physical limitation and safety risks. The first challenge is radiation exposure. X-ray use ionizing radiation which has enough energy to damage DNA, while a single chest X-ray has a very low dose that roughly equivalent to a few days of natural background radiation. Repeated exposure over a lifetime can marginally increase the risk of cancer. So, special care must be taken with pregnant women, which risk given to the fetus, and children whose growing cells are more sensitive to radiation. Moreover, another challenge is the limited soft tissue contrast, which is the shadow problems. X-ray pass easily through soft tissues like muscles, ligaments, and tendons, making them appear as vague gray shadows. An X-ray cannot effectively show a torn meniscus in the knee, a brain tumor, or early-stage liver disease. For this, an MRI or ultrasound is required. Now, the last challenge of X-ray imaging is the 2D representation of 3D structure. A standard X-ray flattens a 3D body into a 2D image. Structures often overlap like ribs covering the lungs, potentially hiding a small tumor or fracture behind another bone. This often necessitates taking image from multiple angles or upgrading a CT scan, which is essentially a 3D X-ray.
MRI machines are expected to be faster, smaller, and more affordable. With the help of artificial intelligence, MRI scans can produce clearer images,
reduce scanning time and detect diseases early. Portable MRI machines may also improve access in emergency or remote areas. Next, X-ray imaging will continue to advance with lower radiation exposure and better image quality. The integration of AI allows automatic detection of abnormalities such as fractures and tumors, reducing diagnostic errors. Future X-ray machine also may be more portable and energy efficient. Moving on to defibrillators, future devices will be smarter and easier to access. They may include real-time heart rhythm analysis, automatic energy adjustment, and remote monitoring. Wearable or implantable defibrillators can provide continuous protection for high-risk patients. Electrical nerve stimulation is expected to improve through AI-controlled personalized treatment setting. This system can adjust stimulation intensity based on patient response, helping to improve pain management and rehabilitation outcomes. Lastly, electromagnetic therapy is an emerging field with potential uses in tissue repair, nerve regeneration, and cancer treatment. Future innovation may allow targeted stimulation of specific cells, reducing side effects and increasing treatment effectiveness.
So, to conclude all of this topic, we can see that the X-ray machine is a perfect practical application of electricity and magnetism. Its operation relies on precise physics, where a high voltage creates a strong electric field to accelerate electrons, and the sudden stop on the anode produces the X-ray, which are a form of high energy electromagnetic radiation. This also shows that ultimately X-ray imaging is demonstrates that by understanding and controlling the basic force of E&M, we can create indispensable tools that are profoundly improve diagnosis and patient care globally.